It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives. Changing lives. Changing lives for the better. For the better. Changing lives.
And hi again, everyone. Jim Knox along with Dr. Nina, and welcome to another episode of Best Doc Network, the show that features some of the best doctors in the Houston area helping change people's lives. Also, Dr. Nina, it's the show about doctors referred by doctors.
That's right. Now here's our first top doctor. It's Dr. Michael Eisman. He's one of the best plastic surgeons in the Houston area.
Graham was swimming in a banana boat with two other people. Two of them fell off the banana boat, and Graham sustained a fracture of his cheekbone when someone's knee struck him in the cheek.
He immediately could tell that something was the matter, and luckily he's an orthopedic surgeon, so he pulled me out, felt my cheekbone, and he's like, "You have a broken zygomatic complex." I'm like, okay. So I really don't know what a broken zygomatic complex means, but I know that if it doesn't feel right, and when I put my hand on my cheek, there's no cheekbone anymore. If I got it taken care of within 7 days, then it shouldn't be an issue of where I got it taken care of. And he recommended that instead of getting it taken care of out in the middle of nowhere, 3 hours north of Atlanta on the weekend, that maybe I should wait to come to Houston and find a doctor who's good and make sure they'll have more time. It's not that pressing.
He saw me with a depressed cheekbone, some double vision and numbness of the cheek, and there was a palpable and visible deformity. He had a significant number of injuries and fractures, and he had no support to the floor of his orbit. So with time, if that's not corrected, the eyeball will drop, he'll have increased double vision, and he will have continued numbness of the cheek. Now the fracture was right through the opening. There's a foramen or opening in the cheekbone where the nerve supplies sensation to the teeth and the upper lip and the cheek, and the fracture went right through that area. Often by reducing the fracture and placing the bones where they ought to be, there's less compression on the nerve, and the nerve regenerates, and there's nearly normal sensation afterwards. But that's about the only residual that he has really right now.
So apparently if I caught the knee a little bit closer to my nose, I could have died. And if I didn't get the surgery, then I probably wouldn't have an eye, because since there's no bone holding it in place, it would have just sunk into my face, and that would have caused a whole bunch of damage to the eye to the point where I couldn't use it. So I think having a second eye is pretty awesome. I like that, and the fact that you really can't tell is pretty unexpected bonus for me. I was kind of thinking, oh, cool, I'm gonna look like some weird, gruesome Frankenstein Quasimodo type situation, and you really can't tell the difference.
Jill came to see me for hearing loss. And then while she was here, she was also talking about, she told me she had some allergy problems, and then also the snoring, and it was feeling like she had insomnia, and she couldn't stay asleep during the night. She was tired during the day, wake up with a dry mouth.
I think you have sleep apnea. I'm going, oh, what's sleep apnea? He said, well, sleep apnea is where you don't get any REM sleep and you don't sleep well. Are you tired a lot? I said, I've always been tired.
We obtained a sleep study and found out that she had a lot of sleep fragmentation from snoring and from sleep apnea.
He said, well, we'd like to do the second test, of course. We diagnosed the fact that you do have a sleep apnea. So went in another night, electrodes, but I had a mask this time. And I fell asleep. I woke up the next morning. It was like, wow. I mean, geez, it was like, I am so rested. So he didn't have to do a hard sell or anything with me. I mean, he said, you need a BiPAP machine. We've decided that, and this is why. And he sat down and explained everything to me.
If you have the other effective treatment option, and you decide to have surgery, and there's something that I think that we're gonna do that has a good chance of making you better, then let's do it. But for some people, it's just not their best interest, and she's happy. Jill sleeps every night, has no complaints, she loves it, it's safe, it's effective, guaranteed to work. Are we going to beat that with a surgery? No. We're not.
My coworkers at the time noticed an immediate difference between, I mean, I didn't tell them what was going on, but they noticed an immediate difference in my demeanor and my approachability.
If that therapy makes you feel great, I just think that your opinion of that therapy is going to change, right? Now, if you can't use it, you know, you're claustrophobic, and you have an obvious anatomic problem, and sure, let's go down this other path and we'll make you better. But better and perfect aren't the same, you know?
It's made a great impact. It's really, the only thing I miss, and this is going to sound crazy, but I'm used to having 22 hours in the day as opposed to 16 or 17, you know? And I can't get as much done as I used to get done because I'm sleeping. But the trade-off is great.
Officer Wayne Schultz weighed an unhealthy 554 pounds until he met Dr. Robert Marvin. To find out more on Wayne's story and other life-changing stories, log on to bestdocsnetwork.com.
Aaron's a gentleman in his 30s who'd had several years of spinal pain coming from his neck. So he had pain in his neck radiating to his shoulders and upper extremities. And at that point, we had diagnosed him as having degenerative disc disease in the cervical spine at 2 levels.
Imagine walking around through your day in your head never being in a place of rest, and you're constantly hurting. And then you think, okay, it's bedtime. I didn't look forward to laying down and going to bed because it still hurt.
So he underwent physical therapy, he underwent some injections, and just the passage of time and taking medications. And over the course of 2 to 3 years, he decided that his symptoms had become severe enough and were no longer responding to what we call non-operative treatment.
Never during that time did he ever say, you need surgery right now. You need it right. If you want to be fixed, you need surgery. You need to go have surgery. Never did that. Those kind of things, not pressuring me, letting my body talk to me, let me know when I was ready. It let me know that he cared.
We offered him fusion of the cervical spine at 2 levels. So fusion means, for example, in this model, that this bone is fused to this bone, and that's called a fusion, so there's no motion here. And hopefully what that does is it eliminates the pain.
The first time I actually laid down without pain, I was excited. I was super excited. I couldn't believe it, because I could never find a point of rest before that. So that's when I was really, really happy about it, and I knew that it worked.
That's one of the more satisfying things about doing what I do, is to hear the positive stories of how the surgical treatment positively impacted the lives of various people. And yes, we do hear the comment quite often that, you know, I don't know why I waited this long to get this fixed.
He said, just don't put anything on your head or carry anything on your head. He said, help me with that. He said, just use common sense. And he said, you can resume your everyday activities. The very next day I was golfing. I just appreciated that, him taking his time. And the end result was just perfect, and it was great. I feel awesome.
Do you have headaches? Of course you do, you're a human being. We've all had headaches. There are different kinds. There's migraine headaches. Those are not the most common kind, but they're the most bothersome. They are usually pounding, throbbing headaches, usually on one side of your head, often accompanied by nausea and vomiting. Sometimes there's light sensitivity or noise sensitivity. Best way to get rid of those is to take some over-the-counter pain medication, even drink a cup of coffee real quickly. Sometimes going to sleep will help get rid of one of those headaches. By far the most common headache is the muscle headache, or a tension headache. This is the headache that may last days and days and days. It's usually a squeezing type pain, like a band around the top of your head, or it can be right in your temples or your forehead or the base of your neck. It's not throbbing, it's steady, and it's caused often by stress, and sometimes it's caused by taking pain medication too often. It can be like a rebound headache. So what should you do for these headaches? There's medication for them. First of all, try relaxation, try sleep. Exercise always helps headaches go away quickly.
A bunion informity is a deviation of the first metatarsal and the second metatarsal. So basically, you know, what people see of their big toe is this. So the big toe is pointing this way, and this bone is going out this way. When it's not matching up well, you get bone growth. And so bone starts to build up right here, and it also starts to build up top.
I spend about 85% of my time traveling, so I'm in and out of the airports. As a training manager, I do a lot of facilitation, so I'm on my feet a lot walking, and it got to the point where even flat shoes, what most people would think is comfortable shoes, became painful.
Her surgery was an awesome bunionectomy, but it was a little bit different because on the x-ray I discovered that she had severely arthritic joint. She had fracture fragments. So these fracture fragments never healed. And because they were constantly moving, it was severe pain. It caused an enormous amount of bone growth on the top and on the side. So I was really excited to do her surgery because I knew it would provide immediate relief.
I'll be wearing the boot for at least another 4 weeks, and then I'll come back for another reassessment. And then he'll determine then whether I can take the boot off and then just start walking in normal shoes.
People always ask, why do I have this problem? And the biggest component is genetics. So if you look at your parents' feet or your grandparents' feet, it's basically telling you, if you see a bunion deformity, that your chances are your feet are going to develop these structural deformities. Then, obviously, for the females, it's wearing the high heels. There's a price to pay for high fashion. You wear the high heel, it puts your foot in position, which predisposes you to a bunion deformity.
Well, I would love to be able to get back out there and be pain-free. A lot of times, I couldn't wait for the day to end because I would be in so much pain. So I'm looking forward to being able to be on my feet for longer period of times pain-free.
The look on the patient's face when they come in and they see the results and they're happy with the results, and they see that instead of having a crooked toe, or that it's actually straight, and that the pain that they had before is gone. So, that's the rewarding part to me.
Now, for more information on some of these amazing doctors you've seen on our show today, please visit our website, bestdocsnetwork.com. That's bestdocsnetwork.com.
That is the place to go, and right now, Dr. Nina, the place to go is our next top doctor. It's oral surgeon, Dr. Paul Metz.
My teeth needed to all be extracted. They were crumbling, they were breaking, I couldn't chew my food.
He's a professional, an accountant, and he's certainly concerned about finances and how to structure his budget. And he was a guy that his lower teeth were worse off than the uppers. And so that was an area that he decided to focus on.
I guess this started in 2009, and this really happened in two settings. So that in 2009, we did the lower, and in 2011, we did the upper. The bottom is all done, and I'm in the midst of having the prosthesis on the top done.
And also with David, his concern regarding his budget, we were able to do this without grafting. Previously, in the upper jaw, because of the maxillary sinuses, we would have to graft those areas. In majority of cases that we were placing a full jaw worth of implants. But with the advent of cone beam CT, we're able to look at individuals from a three-dimensional standpoint radiographically ahead of time so as to know where the bone is, so that we can position implants within that bone and avoid the need for sinus grafting, and then subsequently lower his overall cost significantly, as well as increase the predictability.
No longer do I have to make sure that everything is in place where it's supposed to be in place. I have a new chance at a brand new set of teeth, and they don't hurt.
It's just satisfying to see him come back smiling, see him walking down the hallway, standing upright with their chin up, smiling, and being much more confident. So from a psychological standpoint, outside of the health benefits that you see, the mental health benefits are significant.
I'm a CPA. I meet with clients and high net worth clients. Appearance is important to me. It's certainly not of the utmost importance, but it's important to me. And I don't want to be embarrassed by a crumbling smile line. It's a wonderful, wonderful solution.
The gastric sleeve or laparoscopic sleeve gastrectomy is a weight loss operation, which means we make little incisions, do the operation on the inside with a camera. Physically is a tapering of the stomach down from a big bag that will hold lots of food to a skinny tube that won't hold as much food.
My health was deteriorating. I was so big. I was just having such a problem. I was up over 500 pounds. And I tried to do this, I tried to do that, go to the gym, do this, and those bad eating habits would always come back.
An ideal patient would be someone with a body mass index over 35. About 5% of the population in the United States is morbidly obese.
It got to the point where I wouldn't go eat with my buddies. My guys would be like, hey, Sarge, let's go eat. And I was so embarrassed to wear the uniform and be that big for people to look and go, wow, you know, what's that guy gonna do? And it embarrassed me.
Officer Schultz was super obese. His body mass index was about 71 at 553 pounds, I think he was before the surgery. Statistically speaking, there's virtually no chance he would live to a normal life expectancy at that weight.
I went in weighing 554, and I remember watching the pounds from there. And for that first week, I want to say I lost like 29 pounds that first week, and I was like, wow, here we go. And it was just a steady decrease after that. I had to go through so many uniforms over that year, because I want to say the first year I lost about 150, 180 pounds, somewhere in there.
With the sleeve operation, he's lost over 300 pounds, I believe. So his extra body weight had decreased over 3/4. That put him in a much safer body mass index, and he can expect not to develop some of those medical problems or not have them progress that we would otherwise anticipate with him. And I think he's looking at living more of a normal life than he did before.
If you're going to do the surgery, have the right mind frame. Go in there, do it for the right reason, and use it as the jump. And it'll work. I mean, it's worked flawlessly for me. I feel healthy. I'm able to run down bad guys. So, I mean, I feel like a police officer again.
Dr. Meredith Morgan is one of the best physicians in helping women manage menopause. Practicing for over 35 years, Dr. Morgan, as you see, has a unique office. It's located in the Museum District, a freestanding facility with a relaxed atmosphere. Today's topic, perimenopause.
It's really important to understand that this is a normal process, and it happens with all women. It starts in their mid-40s. The average age of onset is 47, and on average it lasts about 4 years.
According to Dr. Morgan, perimenopause represents a change. Women will experience a number of symptoms.
This is a time of relative estrogen deficiency and brings on mind, mood, memory, and even sleep disorders and irregularities. Yes, there are hot flashes and night sweats that most women think of as menopausal, and yes, they can be just as severe as the postmenopausal ones. But the differentiation between transitioning and a non-cycling constant state is the unpredictability and uncertainty that can be so distressing to a woman.
For women experiencing perimenopause, Dr. Morgan outlines the next step.
We have 3 levels of management. The first will be basically lifestyle adjustments and home remedies. The second is non-hormonal medical prescriptions, and the third is hormonal management. We want to treat at the lowest dose for the shortest duration, consistent with what the need is. We have to understand it's important to use what is acceptable to the woman herself. In my mind, without a doubt, we've taken a step forward for the city of Houston and its surrounding environments. We've developed a site that is comfortable and convenient, that provides medical center quality with minimizing the hassle that's involved. It's been very rewarding to have done this for the last 10 years, and I'm looking forward to the next 10 and 20 years in continuing to do and help women throughout the entire region.
Sharon, she is special in the sense that she was having a hysterectomy in addition to a tummy tuck. So she's, again, had children, had some loose skin, and wanted to have that improved, and had the opportunity to do that at the same time as she was having a hysterectomy.
When I first came to see Dr. Ravella, it was when I was about to have another surgery done. I was going to have a hysterectomy done, and it was something that I was very passionate about. I had tried to lose weight and couldn't get rid of the stomach bulge. So I came to see Dr. Ravella and the staff.
Typically it's someone who's finished their childbearing who will come to us for a tummy tuck. And they might have excess skin that overhangs on the bottom of their tummy area, around the belly button and below. They might have some stretch marks. We remove the excess skin, and then by lifting up that skin, we see your whole rectus muscle, which is the solar plexus. And by pulling those together with suture, it can become firm, like to bounce a quarter off of it.
I was completely impressed with how much caring he has for his patients and the staff has. Everybody was very supportive. Each woman had a different recommendation of what made their life easier or what they've seen patients have an easier time with.
She's now several months out, has lost several sizes, and in addition to the result of the surgery creating a improved body contour, it's actually inspired her to lose more weight on her own, so she looks even better.
I definitely feel like I have had a new lease on life, that I did definitely have a jump start. I feel more confident. This was done completely for me. I didn't do it for anybody else. And in my line of work, that definitely helps to be able to go out and speak confidently to individuals. So it has improved my confidence tremendously.
Kimberly was born with a facial birth defect until she met Dr. Michael Eisman. Now she's a beautiful young girl. To find out more on Kimberly's story and other life-changing stories, log on to bestdocsnetwork.com.
Pretty much allergies has been pretty much since I was born. And then I guess it really came in more in focus when I was diagnosed with asthma when I was 2 years old. And because my asthma is allergy triggered, and basically it's been pretty much a full battle since then.
In the case of asthma, what you have is an inflammation that takes place inside the lung. And this is a normal lung here, which is nice and pink and open. And when a person has an asthma attack, they have a muscle that just actually contracts, and it causes all of the inflammatory cells to come in, and the mucous membranes get very thickened, and over time they can actually become fibrotic and they're scarred. But the real important thing to notice is how red and angry it is compared to the other side.
You know, as a kid, back then, I just didn't have the knowledge or understanding of what was happening. It's just I knew it's like if I gone outside, did things, any activity, it's like my allergies start kicking in, then which then caused my asthma to trigger. I would really hinder my activity as a kid.
But I actually came into Kenny's life in 1997. He was 13 years old and he weighed 285 pounds. And he was homeschooled, I believe, shortly thereafter because he was sick so much with his asthma that he couldn't go to school.
Between the asthma and allergies, everything was just haywire. It's like literally we're trying different combinations of meds every few months because just trying to find that right combination, and finally found that right combo, and it's been pretty good so far.
We got him well controlled, and now we're trying to put him on allergy shots so that we can eventually get him off the Xolair. And hopefully, with the weight loss and everything else, he will be on very little medication.
Especially with Dr. Dickens, she sits down, takes, walks you through everything. She takes, time. She doesn't rush you through, or you're not just a number. She really gets to know you, gets to know your history, and just that personal one-on-one that I don't see with other doctors.
Carpal tunnel syndrome is very common. It's probably the most common thing a hand surgeon sees. The thing with carpal tunnel syndrome is a lot of people get diagnosed with carpal tunnel syndrome that don't really have it. So it's very important that if you have hand pain, numbness, or tingling, that you see a qualified hand surgeon and make sure you get the right diagnosis. Once we get the diagnosis of carpal tunnel syndrome, treatment is geared to trying to take pressure off of the median nerve in the carpal tunnel. Initially, we try to do that conservatively. And the way we do that is with steroid injections into the carpal tunnel, which decreases the swelling around the nerve and takes the pressure off that way. We also place the patients in wrist splints that hold their wrist in a neutral position, particularly at night, because nighttime seems to be when the symptoms are worse. And if we can release the pressure on the nerve in that way, the patients can get significant improvement without having to have the surgery. There are many different kinds of surgery for carpal tunnel syndrome. The minimally invasive techniques serve to go through very small incisions and then cut the ligament that sits on top of the nerve. And by cutting that ligament, the ligament splays apart and takes the pressure off the nerve that way. And that's a permanent fix. The incisions we make are very, very small. They're in the base of the palm and only about 1 centimeter. We only need 1 incision to do our version of a carpal tunnel release. This is comparable to any minimally invasive or endoscopic procedure out there. And we're able to go through this very small incision back to the carpal tunnel and release the ligament that's squashing the median nerve. It only requires a few stitches to close, and patients recover very, very quickly with minimal scarring. All of the minimally invasive techniques and endoscopic techniques have very similar results as far as pain, post-op recovery, and patient satisfaction. Now, it doesn't recover right away, so to have some numbness and tingling after surgery is actually normal because the nerve is regenerating itself. And in severe cases, it can take 6 months to a year before you know what your final outcome is going to be. However, that painful burning numbness that patients typically feel usually gets better within a few weeks or sooner even.
I had 4 children and I just was struggling with varicose veins. With each pregnancy they got worse. When I met him, he tested me for this venous reflux and I was positive in my left leg. And so I was really excited that there was going to be something that could be done to get rid of the pain.
The circulation of the body expands approximately 30% with pregnancy, and that causes the blood vessels in the lower extremities to expand as well. With the expansion of the blood vessels, the valves in the veins no longer touch, and now the blood refluxes.
You get in there and you're with an ultrasound tech, Dr. Kosmowski, and you watch on a monitor where he goes in and he does what's called a closure.
Well, here we are with Stacy, and she has the greater saphenous vein is refluxing or is insufficient. It's been causing her a lot of pain in her legs. The procedure here is to cauterize this vein from the inside, closing it off, which will give her back normal circulation of the legs. The next part will be to start an IV into that vein, and then through the IV will go the catheter that closes the vein.
It was a really short procedure. It was maybe, I want to say 30 minutes. You go home, your leg's wrapped for 48 hours. You have to keep it from getting wet. And then a lot of times that is all that is needed.
It's very easily done, and patients leave the office with a smile on their face, but the greatest reward is to see them back in the office a week later. At that time, the problems have begun to resolve or at times have completely resolved.
After meeting with Dr. Kosmowski, I feel definitely a new freedom on life. My husband and I are worship pastors at the Church of Trophy Lakes, and so he sings and I sing. We always coordinate our outfits, the praise team, and you know, sometimes it really limited me on what I wore. I couldn't really choose to wear any shorts that were above my knee because it was very ugly and embarrassing. And you know, it's already gotten better during this time, and so you know, I'm kind of buying new clothes and feeling more confident.
All right, that'll do it. That'll wrap up another episode of Best Docs Network, the show that features some of the best doctors in the Houston area that helps change people's lives. Also the show about doctors referred by doctors. And for more information on any of the doctors you've seen on today's program, log on to the website bestdocsnetwork.com.
Yes, visit the website bestdocsnetwork.com. And if you have a comment or a question for one of our doctors, we always love receiving your email. So send us an email at info@bestdocsnetwork.com.